Hello everyone. This one was being loud. So, it's Maddie and Andrew, and this is the update for the 5th and 6th appointments.
Yes, with my gender therapist. Thank you for doing that introduction.
No problem, it took you 4 tries.
Yes, it did. Very, very happy, nervous, excited, all of these things. So my 5th appointment was just to help me get ready for my 6th appointment, which would be my last appointment. And there wasn't pretty much a lot going on there, because we already had discussed everything in the previous 4 appointments. So everything that we pretty much discussed was just my feelings as I'm going along, what I'm hoping to expect, and just the things that I'm looking forward to in the future. So for the past couple months, I've been really nervous about whether or not I'd be able to get my letter on time right before my birthday, and I've been really paranoid about it. And just nervous, all the way around. And I had my 6th appointment today with my gender therapist, and look what I came home with! Yes! I got my letter. Says a lot of good, awesome things on there. My gender therapist wanted to make sure that I was okay enough to see the doctor and start taking testosterone, and when he handed me this letter, he was confident that I was ready enough to take this next step in my journey, and it really means a lot, and I'm just really excited, and it's just an awesome feeling.
Super proud of you.
Yes. I also want to thank, especially this one, for being as awesome as she is, and just keeping me positive as well. When, behind the scenes, when I'm really down, and I'm really upset, and things like that.
Or dysphoric.
Yes, with my dysphoria as well. She did help me buy a binder, which is really awesome, because now it's more at ease. I feel more comfortable going out, and I don't feel like I have to hide in the house. So it's really cool, and thank you so much.
You're welcome. I'm very proud of you.
Yes, now she's going to help me pack after this. It's going to be really awesome.
I don't know if I signed on for that. I do not know, and if you don't know what it means, don't Google it.
Yes. I also want to say thank you to everybody who's been just following along my journey and have been encouraging me to just stay positive and all of those awesome things and comments and likes and stuff. And it's just really awesome to hear from everybody. And I do want to read my letter to everybody because it is really awesome, and I just wanted to share it with everybody because it is something really awesome that I get to celebrate with myself and everybody pretty much who's been following, because you guys are awesome as well. Alright, so here goes. I am writing to recommend gender confirmation hormone therapy for Andrew, who has asked me to prepare a letter of support. Andrew may be a new client of yours, and this letter is to inform you of his desire to medically transition and seek medical guidance with hormone replacement therapy. I have met with him a total of 6 times for assessment and 5 psychotherapy sessions. His history reveals that he has experienced depression, anxiety, and high levels of dysphoria. Andrew's current diagnosis is gender dysphoria. Since childhood, Andrew has been strongly and persistently aware of the desire to be male, creating a severe mind and body conflict. The purpose of psychotherapy has been to explore and resolve this conflict. We have reviewed history and have discussed in depth the plan to transition. Andrew is a 23-year-old genetic woman transitioning to male. He presents as an average height, well-adjusted male. I wish it was height, weight. Yeah, one day. Okay. He presents as male most of the time. Andrew fits the diagnostic criteria for gender dysphoria of adulthood. Currently, there are no morbid psychiatric conditions. The patient's intellectual functioning is above average, his adaptive skills are good, and the patient exhibits a low frustration tolerance. Andrew's capacity to delay and employ competent defense mechanisms is consistent with circumstances. The patient is oriented to person, place, time, situation, and reality, and eye contact is good. Verbal content is appropriate to effect. There is no evidence at this time of cognitive distortions nor physical manifestations of mental disorder. Patient denies any suicidal or homicidal ideation or plan. Andrew has revealed plans to significant family and friends, most who are supportive. He is married to a loving and supportive wife. He has also taken appropriate action to prepare for the coming out process in his workplace and has the support of his administrative leaders. He is aware of the procedures, requirements, costs, details, complications, and surgical and non-surgical options available to treat his gender dysphoria. He is capable of making informed decisions regarding ongoing gender reassignment treatment. Conclusion? I am writing this letter to you at the request of Andrew to inform you of my opinion that at this time he is prepared to proceed with HRT. I have recommended that he continue to receive therapy during his transition, but that will be the decision of the client. Patient has met the standards of care eligibility criteria. Yes. And that is it. Awesome.
How do you feel about it?
I feel really good about it. I'm really happy that I get to close this chapter and I get to start a new one, which is ultimately what I wanted. And
progressing on time.
Yes, right before my birthday. Making things happen. So I'm not done with gender therapy. I will go and see him every month and, just give him updates on how I'm doing, just because I do have a history of suicide attempts and suicidal ideation, and he just wants to make sure that I'm still on the right track. So I will continue to do that. So not I, it was a joint effort.
Okay. I was going to say, was I gone?
No. We upgraded into a nice-sized family vehicle for us and our 3 puppies. We got a Jeep, and it is very awesome, drives very nice, and just so much room, and the dogs already love it. They have, we put the seats down in the back, and now they just have all this space to lay around and walk around and be very annoying. Yeah. But ultimately, that is also a good transition as well, because now we have a vehicle where we can hold our current babies, and now we can also have room for our future children, and that will be very awesome. Starting that process as well, because I truly want to be a dad in the near future, if I can. But yes, my youngest fur baby now has a boyfriend named Zach. I didn't think it would happen this soon. Teddy, who is older than Ellie, doesn't have a boyfriend. I don't think she'll ever have a boyfriend, because she just
all about herself.
She's all about herself and her treats.
And cake, yeah.
Yes. She has a boyfriend named Zach, and I approve of Zach's parents, Al and Glenn. They're awesome. They're really awesome people. Since we're doing shout-outs now, I will start out and shout out Al and Glenn. Al's been very supportive of me, just always having my back, and it's really cool, to have that. And then having Glenn, because Glenn is he's a hoot. He's hilarious, and apparently he's actually a spirit animal. And they get along together very, very, very well. I also want to shout out everybody in our PFLAG group, because the first meeting, I met a lot of people there that, have really been able to help me get farther in my transition. Just watching them grow, and just listening to the things that they've been through. I mean, from all different sides. Just listening to everybody and hearing all of their stories has really helped me shape who I want to be, who I am, and it's just encouraged me to keep going forward.
It's like watching It Gets Better videos.
Yes.
Yes, it's really great. It gives a lot of hope on all sides.
They all have actually definitely given me a lot of hope and encouragement and support as well. So thank you guys. You guys are really awesome. did have a family member come out to one of my meetings, and that was really awesome, actually, after feeling like maybe I was going to take this new step in my journey, possibly without any of my immediate family. And, that really bugged me out, especially because the holidays are coming up, and it's like, okay, well, now this is a time of year where everybody usually gets together, and you're supposed to value family time and each other, and it was going to be rough. I knew it was going to be rough. But just, she came out to the one meeting, and, that was really awesome, and I'm hoping that in the future she'll be able to come out to more.
I hope she got some answers.
I hope so too, and maybe solved a little bit of maybe some of the not problems, but like the questions she had. I mean, it was brief, but maybe she had some questions answered, and maybe it'll make her want to come out more and to really discover and understand, and it'll be really awesome, really, and I'm really happy about that. And I hope that she continues on her journey to understanding me, because it will truly mean a lot. A lot. A lot. Yes. So, right before my birthday and the holidays, I want to shout out all of our families, both sides, near and far, and everybody, all of our friends as well, who are just being supportive. Liking, sharing, commenting, and, just
going out of their way and posting. They don't have to say anything, and the ones who do.
Yeah.
It means a lot.
It does. It truly does mean a lot. Just to see that, like, I put up a picture of, myself, and then, like today with my letter, and I get, like, tons and tons and tons of likes, and then tons of comments that are like, oh, congratulations, you're awesome, this is awesome, and it just makes me feel really good. Like, like people are valuing the fact that I am on this journey to be who I am, to grow into who I am, and just have it show just outward and, not inside anymore. I don't know how to say it, but yeah, it's really awesome. It means a lot. And I want to thank you guys, because, yeah, you guys are really awesome. I am going to tear up. I am tearing up. I'm tearing. Oh, yep.
You're always crying.
I know. Because I'm emotional. I'm an emotional guy. I don't know if that'll change.
Probably.
I'm going to be a hard ass later on.
You'll probably be real douchey.
No, I don't want to be a douche.
And then you'll need a new wife.
No, I like this one. I like this one.
Thank you.
Alright, guys. I guess that's it for this update.
Hopefully it's under 8 minutes, because I keep getting yelled at for making them really long. Cannot help that I'm entertaining. Just saying.
She can't. Funny face time? Okay, I guess that was good. Alright, guys. Well, thank you again. Hopefully we'll make another update or video pretty soon. Sometime around the holidays, just to tell everybody
what's going on.
Yeah, pretty much what's going on. Alright. Well, thank you guys.
If you don't celebrate your birthday with the video.
Yeah, right. The turn up video.
No.
Yes.
The last time you turned up, it was not a good scenario. Remember, Whitney? Just saying.
I don't know. Does Whitney remember that? We were both pretty turned up.
I don't know if either of you remembers
really
that.
Turned up.
I remember.
I know. She's our DD. Alright, guys. Well, again, thank you guys all again for all of the support and just being here. It really does mean a lot. And I hope you guys have a really, 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 really awesome holiday. Lots and lots of turkey. Hopefully. Yes. Well, thank you. And we will see you guys again. Bye.